Okay, hi everybody. This is Dr. Uzi Chen here, and I'm here to continue talking about the small intestine channel, specifically the posterior shoulder aspect of that channel. There are 5 points I'd like to include in this part. These are very, very important points. We're going to be talking about how to locate small intestine 9, 10, 11, 12, 13, and 14. Sorry, 13, 14, and 15. Please pay attention to the body landmarks that I'm going to be discussing, okay? We'll start with the small intestine 9. Small intestine 9 is defined as 1 cun superior to the posterior axillary line. So we can see the axillary line right there. It's a little ticklish, I know. We want to go about 1 cun above till we find a little bit more tissue right there. That's small intestine 9, okay? Small intestine 9 is a great point that allows access to the external rotators of the shoulder, as well as some other important muscles like the teres major and latissimus that are so useful when we're treating shoulder injuries. Okay, so from small intestine 9, I want you to pay attention to that landmark here. Basically, the scapula, before we do anything, we want to know where things are. So the inferior angle of the scapula is going to be right there. It's a little ticklish, right there between my 2 fingers. I would encourage you to use 2 fingers so you know exactly where the tip or the inferior angle is, right there. With that said, we want to also recognize the spine of the scapula. Yes, you have a spine for your scapula, and this is between the 2 fingers here. That spine divides the scapula into the superior fossa and to the inferior fossa, okay? When we're looking for small intestine 10, we're going to go and travel down the or laterally across the spine of the scapula till we hit the acromion. That's the bony landmark that you can feel on the patient right there, okay? 2 very important aspect is to find the corner or the posterior lateral corner of that acromion. So I'm using 2 fingers here to actually show you the bone or the posterior corner is very prominent and is right between my 2 fingers right there. Now that is helpful because my index finger right here is going to actually determine the location of small intestine 10. So if we are looking into the definition by the book, it's right above or superior to small intestine 9. And you can see it follows along the same definition for the most part. So again, I'm going to put a note, small intestine note, mark, sorry. Small intestine 9, posterior axillary fold, 1 cun up. I'm digging in a little bit. I feel the tissue. I know it's right there, right there. Small intestine 10, I want to know where I am in space. Okay. So it's a little ticklish, I know. And then I'm looking for that corner, which I'm housing between my 2 fingers. So now my middle finger is right on small intestine 10, and it's right there. I can feel the divot right there. There is a divot there. Okay. Now, small intestine 11 is important for us to know. Please relax your shoulder here. Thank you. Okay. So we know where the inferior angle is. Again, sometimes not that clear. We want to be able to find it. Right. Relax. Okay. And then that's the spine of the scapula. So the medial border is right here. And I'm covering it a little bit with my fingers. We really want to be able to tell where the spine of the scapula actually meets the medial border. So that's the medial border. This is where they merge in, okay? That point here, just because I already found it, that's going to be small intestine 13. So let's make a note right there, or a dot right there. It's in that little pocket that is just superior to where the spine of the scapula meets the medial border of the scapula, right there, okay? Now, small intestine 12 is going to be sort of like halfway between the small intestine 13 and small intestine 10, but it's halfway on the spine of the scapula on the superior border. So we're going to find the spine and then go over that. That's going to be small intestine 12. It's right there. This point is important because it allows us access to the supraspinatus that resides in that area. So small intestine 9, small intestine 10, small intestine 13, small intestine 12, and let's find small intestine 11. So again, sorry, try to not tickle your patients here. Inferior border, medial border runs in that line here, okay? and then lateral border is going to be right there. This is where I'm feeling bone right here. So that's my triangle, if you will, of the scapula, right? So I'm finding the spine again, half point of the spine, west-east, if you will. And then that point from that lower border to the inferior border, we're going to make thirds. So that's our thirds. And then right where my right thumb is, that's going to feel, I'm going to look for a small depression. Right there is probably a little tender, right there. That's small intestine 11. I'm going to put a note here, not a note, but a point. So again, how to find small intestine 11? We want to find the inferior border of the scapula. We want to be able to determine where is the medial border. It's right there. Lateral border right there. And then this is where we're going to see the spine right there on that line. Let's actually make a line here. Right there. Okay. Now we're taking halfway of that line is about here, matching with small intestine 12. Lower border to inferior angle, which is here, that's going to be our thirds right there. Looking for a tender divot or a depression, that's going to be our small intestine 11. Or last, only 2 more points. We have these 2 points are going to be referred to from the spine. Can you please bring your left arm here? Yeah, thank you. Yes, relax. So we're going to find small intestine 14 level with the transverse process, sorry, the bottom of the spinous process of T1, okay? And then small intestine 15 is going to be level with the bottom of the spinous process of C7. But how to find C7 and T1, that's what's important. I want to make sure that you can take both of your hands and press down the shoulders, because as you're going to push here, we want to make sure we know where is the first cervical rib. The first cervical rib attaches with the spine at T1. That means that everything below my fingers is going to be free of ribs. Okay, so as I'm looking for the spine, I can tell, oh, that's going to be the C7, and this is T1. Okay, alrighty. Small break there. Okay, so what's important again is we finding the small intestine 14 and 15 is we want to depress a little bit and gently the upper trapezius down, so we know where is the first rib is gonna be. We know for certain it's gonna be below or inferior to where my fingers are. So I know that C7 is around here, and then it should be falling along the line of the acromion, which makes sense here. If I go one below, that's too low. If that's C7, that means that it's just too low. So we know that's T1. From here, we're going to measure 3 tune up right there. That's the middle border of the scapula right there. Let's put a line for that. Right through here. If that's our 3 tune, small intestine 14 is 3 tune out, level with the T1. So that's our point here. And then if we go one more or one above T1, C7 again, right there. And then that's our 3 thirds, 2 out is going to be right there. And you see the proximity with what we call the base of the neck musculature and the effect on the lung function because of the proximity to that segment. Okay, so 9, 10, 11, 12, 13, 14 is a little close here, and then 15. I do want to point out one last thing regarding those points, and that is if the patient would have to keep his arms here or even down here, which is very common, you'll see that the shoulder blade has to accommodate to that abduction of the arm, causing the whole thing to change. Now the medial border of the scapula is here. Sorry, just a second. The middle border is really here. It's a very different scapula, so to speak, and it's ticklish, I know. So we have to accommodate everything we did according to the position of the shoulder blade. I hope it was helpful. Thank you.